As part of providing a health and aged care system that looks after all people at every stage of their lives, the Australian Government is committed to improving access to high-quality palliative care. Investments are being made to ensure that more Australians understand their options for palliative care in a variety of settings, including residential aged care and the family home. The Department of Health and Aged Care is supporting the primary health and aged care workforces with the knowledge and resources that they need to deliver best practice, person-centred palliative care. This includes assisting healthcare professionals navigate a range of information tools, education and training to help build their confidence, communication and clinical skills and improve the palliative experience.
It's really important that we're not just focusing on the physical issues that are affecting a person, that we're also looking at what is the impact on their psychological, emotional, social and spiritual life from the experiences that they're having as they approach the end of life, and that the work that we do with people is carried out in a sensitive and culturally appropriate manner as well.
Market research conducted on behalf of the department reveals a strong desire by healthcare workers to deliver truly personalised and inclusive palliative care. But we need to continue to support the primary health and aged care workforces to talk about palliative care with patients and their families, to break down the emotional barriers and misconceptions which persist today.
Existential questions come up for people. Is there an afterlife? All of those sorts of really practical questions for people when they're facing the end of their life come up. And being able to give people reassurance, spiritual guidance at that time is very important.
There was clear evidence from the research that strengthening workforce understanding of holistic palliative care and how it can complement active medical treatment will encourage these important early discussions about palliative care options.
Some of these interventions and initiatives don't need to be complicated, but they need to allow people space, time to have conversations in psychologically safe places about how they're feeling, the emotions they're going through as they look after people with palliative care.
Open communication, information sharing and service linkages are essential to ensuring seamless palliative care. As such, health practitioners are being supported to hold regular and compassionate conversations about when to commence palliative care and the end-of-life journey with patients and residents who are suffering life-limiting illnesses.
Palliative care has so much to offer early in the course of an illness, and the challenges, though, in introducing those conversations early is that our community also doesn't often understand what palliative care is about and the benefits and choices that actually might provide them, their individuals and families.
The research, which the department has now released, has uncovered critical insights into how we can continue to support the palliative care workforce to deliver quality palliative care.
Workforce is critical. And I think we need to stop the idea that one day you're acute care or old and the next day you're palliative care. We're really talking about a much longer, for most people, those of us who are fortunate enough, lucky enough to live into old age, that's a very slow transition, really over years, and that the conversation about the last phase of life needs to start years before that actually happens.
Palliative care encompasses the physical, emotional and mental health of the patient. Healthcare practitioners express a high level of willingness to provide palliative care and report high confidence in key symptom management and clinical skills. 88% indicate they are willing and comfortable in their ability to provide palliative care and end-of-life care to patients. But there are barriers to providing quality palliative care, with the majority of healthcare professionals citing a lack of advanced care planning amongst their patients. 54% of healthcare professionals report a lack of advanced care planning limits the ability to provide quality palliative care. When done properly, advanced care plans will support the patient's voice and help to reduce family conflict, which is one of the key challenges faced by nurses and other carers. 3 out of 5 healthcare professionals say providing quality palliative care is challenging, with only 1/3 finding palliative care is personally rewarding. 88% agree or strongly agree that dealing with the emotions of the patient and the family is the hardest part of delivering good quality palliative care. 88% of healthcare workers surveyed indicate they are comfortable delivering palliative care, yet only 78% are comfortable discussing palliative care. High quality support for carers is essential. Carers strongly emphasise their own needs must be considered as part of the palliative care experience. 81% believe that it is important for carers and family to be able to speak directly with healthcare teams privately from the patient.
Research highlighted that many of us feel that we could benefit from more education and training about palliative care, particularly about having those challenging conversations with our patients or our clients.
We have a great palliative care system in Australia, so we're in a really good place, but there still seems to be these barriers in terms of ensuring that that high quality care is made accessible to everyone. Part of those barriers are, I think, due to healthcare professionals not feeling confident, healthcare professionals not feeling equipped to be able to do their part in palliative care delivery.
It's really important to give clear information and to connect people with the specialist palliative support they need.
Palliative care as a medical specialty and as a clinical specialty is no different than orthopaedics or cardiology. I need holistic care, and the only way that can happen now with our medical specialties is through strong and integrated primary and aged care services. So seamless care, where we stop thinking about care being delivered by this specialty or that specialty. It all has to come together at end of life. It's by far the hardest clinical care because it requires impeccable communication and impeccable coordination.
Normalising community perceptions of palliative care is essential to enabling the workforce. There is a clear desire to build community understanding of palliative care beyond end-of-life care, to make the conversations easier to have without destroying patient trust. Caring for people with life-limiting illnesses is vital and rewarding work, but it can be challenging and emotional. This research underscores the essential role that health and aged care workers play in delivering high-quality end-of-life care. The Australian Government is making significant investments in programs and resources to build their knowledge and skills and boost their confidence to deliver truly personalised palliative care. We will continue to support our highly valued healthcare professionals to help patients and families make informed decisions about the palliative care that best suits them.